Okay, thank you for coming to this session, Challenges to Patient Navigation and Lessons Learned During the Pandemic. I am Ashleigh McKinsey. I am a West Virginia Impact Program Coordinator as well as a patient navigator, and I work for the Burlington United Methodist Family Services demo site. We have a couple of objectives that we will address during this presentation. The first is we want to define neonatal abstinence syndrome and explore the prevalence, specifically within West Virginia. We also want to identify challenges that the patient navigators were introduced to by COVID-19. We will also describe alternate social services resources during COVID-19. So things changed a lot during that time period. And then also some lessons learned once the pandemic is over and we resume normal life. So, what is neonatal abstinence syndrome, or NAS? It's a drug withdrawal syndrome that most commonly affects infants after in utero exposure. Some of the symptoms that we find are low birth weight, preterm birth, stillbirth, and then birth defects. And those possible symptoms are body shakes, tight muscles, seizures, some fussiness, diarrhea and vomiting, breathing problems, as well as some trouble sleeping. So from the time period of 2010 to 2017, NAS rates increased from 4 per 1,000 births to 7.3 per 1,000 births. Maternal opioid-related diagnosis in 2017 were 40.1 per 1,000 delivery hospitalizations and 47.3% increase in overdose deaths from 2019 to 2020. So looking at specifically West Virginia, 51.5% live in households with incomes less than twice the federal poverty line. 12% are grandparent-headed households compared to 8.4% national average. The infant mortality rate in West Virginia is 7.1% versus the 5.7% national average. The TANF benefits among families in poverty, only 9.8% receive them in West Virginia versus 21.7% of the national average. So we have a lot of people living beneath the poverty line, but not as many as the national average receiving those TANF benefits, which were formerly known as the SNAP benefits. 48.1% of West Virginians live in rural communities. And this is important to remember later as we talk about the challenges. 145,000 West Virginians have substance use disorder. However, we only have 2,400 beds at long-term facilities and 1,100 at short-term facilities. Gaps in care. So 90% of families report that they did not feel they got the support or the training they needed from the Division of Health and Human Resources, or the DHHR, to care for a child who is born substance use or substance dependent. 46% increase in the number of children that Child Protective Services took into custody. 84% of all of those cases involve substance use. And unfortunately, West Virginia leads the nation in percentage of children who do not live with either of their parents. So now let's talk about West Virginia Impact as a program. It is a multi-generational approach program in the Northern Panhandle and North Central West Virginia. There's a couple goals to the program. So the first goal is to reduce disparities in health and well-being of children diagnosed with NAS, women who were or are still using substances, and their families who receive services from home visitation programs. This is important because for the first time, families that do not have current custody of their children, so the children might be in foster care or kinship care, we're able to provide resources to both those families. Another goal is to ensure effective implementation and expansion of evidence-based home visitation services and coordinate services from prenatal to age 3 or until he or she ages out of the program. So some of the needs that are addressed through West Virginia Impact are food insecurity, shelter, clothing, transportation, childcare, and general social service needs. So now I want to get into kind of the challenges that we faced. The first one was a big one, transportation. And this is where we kind of tie back into where I said there's West Virginia's predominantly rural. Patient navigators were no longer able to provide direct transportation due to the stay-at-home orders and social distancing. And that rural landscape and lack of accessible transportation really provided a challenge. So some of our solutions, there's a program called Modivicare in West Virginia, and formerly was Logisticare, and it provides non-emergency medical transportation. So if they had a doctor's appointment, a prenatal appointment, or an appointment for the baby or themselves, we were able to get them to the necessary places that they needed to go. They also provide a gas reimbursement for others to provide the transportation. So if they had a friend or a family member that was willing to drive them, Modivicare would reimburse them for gas. Somehow I just switched my slides around. So challenge number 2 was in-home visits. So again, coming back to rural landscape, caused issues when the home visits moved to telehealth. Accessing Wi-Fi in some issues were an issue, and cell phone service was also an issue. So solutions to those were we did phone calls, we used social media messaging apps to be able to maintain regular communication. So some clients we were not able to have video calls with, some just had to be phone calls, some just had to be text messages when they had Wi-Fi. It really depended on what our clients were able to do. Challenge number 3 was very difficult. So obtaining documentation during shutdown. So in order to get our clients housing or things like that, we needed to help them get documentation. However, government offices were shut down, and that documentation, such as social security cards, birth certificates, identification cards, like I said, that were necessary for these applications were difficult to obtain. No one was really working in the government offices. So we had to get creative. We utilized local community actions to submit alternative documentation for utility assistance. So maybe they would take, if they didn't have both a social security card or birth certificate, maybe they would take one or the other, or we were able to utilize different ways to verify their identity. As well as we made appointments online for clients for those state identification cards. So challenge number 4, employment difficulties. So it seems that COVID affected pretty much everyone, that everyone kind of knew someone that had lost their job due to the pandemic. So something that was really great that we had with Impact through the pandemic was we were able to make referrals to an employment and educational specialist that we have on staff through West Virginia Impact to help clients get ready to re-enter the workforce. They help to build resumes and get them ready for interviews, work on some skills, provide referrals to Jobs and Hope if that was needed. And then because of the financial impact of layoffs and job loss, West Virginia Impact was able to provide household essentials temporarily, such as hygiene and baby products, such as formula, to help kind of offset that financial impact. Another challenge that we had was housing. There was a higher level of domestic violence incidents during the pandemic. So certainly we saw that with our clients as well. So we had to find alternative housing, and sometimes quite quickly. So the public housing authority offices were closed to the public. There were long delays in securing housing. At times it was 18 months. So some of the solutions, patient navigators were able to help their clients by obtaining paper copies to be mailed to the housing authority offices, since they could no longer go and get the application. So it was important to be able to continue pursuing housing for a lot of these clients, because this is a major step in them becoming reunified with their children that oftentimes were either in a foster family or in kinship care. If we needed something more immediate, patient navigators were able to provide a list of shelters if their current housing situation was unsafe and we needed them out of that situation immediately. And like I kind of talked to previously, there was a higher incidence of domestic violence and mental health issues through the pandemic. People were isolated. So things kind of came more to the surface. So some of the solutions we had there were referrals to mental health providers that were offering telemedicine. A lot of clients really enjoyed the telemedicine therapy sessions because they didn't have to leave their homes. They didn't have to worry about a babysitter. It was all right there. We also provided helpline information. If a client were to call and say, hey, I'm in crisis, we were able to help them immediately. Oftentimes it required 2 phones, and you'd be on the helpline with one and on the phone with the client to make sure that everything was going well. And another additional resource that became crucial during the pandemic was West Virginia 211. So you would call 211 and someone would answer. They would ask you what county you're looking for services in, and they would provide a list of information on different things like food, housing, transportation, health, financial assistance, work, and legal. And this was especially crucial during the pandemic because of the changing and expanding resources. So maybe some places were not giving out food because of the pandemic and other places were stepping up. So it really helped with the ever evolving nature of the pandemic. So now let's kind of talk about a few lessons learned during the pandemic. COVID-19 made patient navigators have to think fast to provide high levels of service during transition of in-person to exclusively virtual. Because of HIPAA laws, it was a lot of troubleshooting, a lot of problem solving, a lot of figuring out how this was going to work. There also had to be quick adaptation because of access issues, because of the remote nature of West Virginia. Like I've been talking about, that rural landscape really kind of provided a barrier to a lot of services. And then probably the most important thing that came out of the pandemic is the importance of the patient navigator's own health, both mentally and physically. So we refer to this as putting your own oxygen mask on first. So if your cup is not full, you are not able to fill the cup of your clients. So it really became important for patient navigators to really work at making sure that they were healthy themselves. There was a lot of having to practice self-care and take more time to kind of center yourself, because a lot of the issues that we were dealing with were magnified by the pandemic. So that was very important. And then just some references. And I just wanted to thank everyone for coming to our presentation today. It was short and sweet, but I hope you were able to learn something. And I will, if you would like to reach me, my email is aemckinsey, McKinsey @bumfs.org. So thank you very much.